Good afternoon. Our discussion today will be on location, location, location. Enter in the zip code lottery today. The health disparity we will be discussing in this presentation is low socioeconomic status and how that correlates to someone's zip code and their life expectancy, because health is unevenly distributed across socioeconomic status. For example, persons of lower income experience worse health and die earlier than their better off counterparts. It is important to realize the low socioeconomic disparity as a nurse to limit bias when treating in a low socioeconomic community. Nursing can impact this disparity by treating everyone as they would like to be treated, without bias and with patient-centered care. These conditions are known as social determinants of health. Conditions in the places where people live, learn, work, and play affect a wide range of health risks and outcomes. As you can see, economic stability is one of the 5 main social determinants of health. These are the health outcomes that you can see with the social determinants of health. As you can see, economic stability on the far left, it lists out employment, income, expenses, debt, medical bills, support. This all correlates back up to the health outcomes at the top, which include mortality, morbidity, life expectancy, which we are focusing on, healthcare expenditures, health status, functional limitations, and more. Health. There's certainly a health equity problem when it talks about zip code and life expectancy. For example, nearly 1/5 of all Americans live in low-income neighborhoods that offer few opportunities for healthy living than residents adjacent in higher wealthy communities. Also, low-income zip codes have 25% fewer chain supermarkets and 1.3 times as many convenience stores compared to middle-income zip codes. Children from low-income families are less likely to have access to high-quality early education and less likely to be prepared to succeed in school, while in distressed urban communities, the large numbers of blighted and vacant homes depress property values. This is just a good example to really show the country, and you can see from as far away to California and then all the way on the East Coast. This picture, it focuses in on the southeast, and you can see in New Orleans the zip code for 70112, which is the French Quarter. The life expectancy is 54 years old, while in the Orleans Parish, 70124, it is 80 years. To bring it more close to Vermont and Boston, in Back Bay, which the zip code is 02116, it's 92 years of age is the life expectancy, while just in the greater suburb area, Roxbury, it's 59 years old. You can also see that in the Midwest, and it doesn't matter where you are in the country, that the zip code matters depending on where you live. Here's another example in Texas of Harris County, and you can see the outlines just even within that county, and the different colors are correlating to the life expectancy. So the dark blue, it's 86.5 or more years, and then down to the red or kind of that orange color, it's less than 70.5 years of age is the life expectancy. So you can see just even with a small area that life expectancy really does depend on your zip code. Even if you bring it back to Vermont and you can think about the Chittenden County and Winooski or Shelburne or Essex, anywhere in between there, those life expectancies can be different, just miles apart. So just for an example in Chittenden County, to bring it back down to the school level, which is also the education is a social determinant of health. In the Winooski public school system, 98% of the students are on the lunch program, 26% of the families fall below the national poverty line, 53% of the students are from low-income households, and all of those are kind of striking statistics comparatively to the national average, while also 50% of the student body are students of color, and 28% of the English language learners. Just a brief, this is an assets map of Winooski, and you can just kind of see there's very limited supermarkets. There's actually no supermarkets. Shaw's at the top and Costco are technically in Colchester, while the only real two places you can buy food or is that an Asian market, which is in the center of town, and then at Commodities, which is a commodity, it's higher food costs. And then you can see the surrounding area where the schools are and the limited parks and surrounding area.
For the first time in history, we live in a generation where children are likely to live a sicker and shorter life than their parents. The major causes of health disparities need the input of the community and government to develop health promotion programs toward achieving a solution. Healthy People 2020 have set a goal to eliminate disparities and improve health of all communities. It is a major responsibility of nurses and other healthcare professionals to reverse the trend, but unfortunately, not everyone has the same opportunities to live a healthier lifestyle. A study shows that physicians admit to changing the style of care based on a person's socioeconomic status. Most of the changes made contribute to more affordable, feasible, or comprehensible health care. For example, the result of financial and insurance restrictions result in the physician prescribing less expensive medications, avoiding referrals to outside specialists, postponing testing, and trying to accomplish everything in one single visit. While these physicians describe the difference in care as being in the patient's interest, the conflict arises that the discomfort of the socioeconomic status results in poorer outcomes in health of these communities. Training in the medical field is evolving toward the idea of patient-centered care, and it is our duty as nurses, along with physicians, to accommodate low socioeconomic communities to provide the best quality of care. Tailoring the care of such communities based on financial restrictions may seem appropriate, but it does not reflect the values or health beliefs we as healthcare professionals know to be true of providing equal care to everyone. With the help of promoting alternatives that are appropriately incorporated into treatment decisions with the consideration of financial, cultural, and level of education of each patient, many of these challenges can be resolved. Accounting for preventative measures based on data found to be common illnesses affecting specific zip codes can help decrease the likelihood of a high mortality rate and promote the importance of public health education. According to the World Health Organization, many diseases are more common and life expectancy is shorter at the lower rungs of the social ladder in each society, which has been recognized for quite some time now, and the gap between rich and poor continues to be the biggest health hazard to this day. High-quality healthcare is essential to maintain a healthy lifestyle, but where we live has an even greater impact. Ensuring communities have access to healthy, affordable food, quality schools, in education, appropriate housing, and employment can provide the resources necessary to help an illness from imposing a risk to the community in the first place. So what can we do as nurses to change our attitude towards people with low socioeconomic status? Nursing is rich for advocating a healthy society based on the foundation of social justice. The legitimacy and success of public health strongly depends on recognizing and appropriately addressing the social, economic, and political challenges of health in each location. By including service learning treatment into nursing education, the belief of empathy and enhances views on social and equality. Along with other challenges found in the healthcare system, differences in income within populations of lower socioeconomic status must be fundamental consideration when planning and delivering patient care, but not to the extent that the quality of care is altered in comparison of another who stands in a higher financial tier. Together, we as nurses plus other health professionals need to create a society where differences in care based on socioeconomic status is unacceptable. It is important to remain true to our heritage of advocating for a healthy society for everyone.
Over 100 interviews were conducted with patients of low socioeconomic status to draw qualitative research to describe the different issues and experiences these patients had with healthcare. The interviews revealed that along with the financial stress from cost of care, taking time off from work was a problem for most. When patients managed to schedule appointments, they reported waiting up to several hours to see a provider at their local clinic. This led to further problems at work and lost income for them and their families. To avoid the lost time and scheduling difficulties, patients reported often avoiding doctor's appointments altogether. Additionally, the interviews revealed that many patients had poor experiences with their care. They distrusted the providers and staff they saw, stating they felt rushed and not properly listened to or cared for. With these poor experiences, most felt reluctant to even seek treatment elsewhere, foregoing needed care. Where are we now? Current intervention strategies to improve healthcare disparities tend to focus on disease-specific solutions, often failing to address social determinants of the issue. Interventions aimed towards individual-level factors include improving health and lifestyle behaviors, such as access to food, education regarding the benefits of physical activity, and employment resources. Health system interventions have included strategies in addressing discrimination, access to care, and improving quality of care. However, these interventions fail to address socioeconomic factors such as poverty, neighborhood conditions, access to better educational systems, and more. Solutions that have made a positive impact include the following. Improving access to quality education is likely to improve health. There is strong evidence indicating that early childhood interventions like structured early childhood education and parental support programs show promise for addressing the economic disadvantage and health disparities. These kinds of programs can reduce disparities by improving these conditions early on. By focusing on improving experiences early in life, it's critical to reducing and eliminating population-level health disparities. Importance of healthy communities and environments. Studies have shown changes in nutrition, physical activity, and safety within communities can be achieved through community development and urban planning, which in turn can improve healthy behaviors. Housing. Housing quality and safety are known to impact health. A program called Yonkers Scattered Site Public Housing Program randomized low-income residents to newly constructed housing in middle-income neighborhoods. The move was associated with better self-reported health, decreased substance abuse, and increased employment rates. Health exceeds beyond what happens in a doctor's office. As previously mentioned, many factors influence our health. The opportunities we have are largely determined by where we live, social and economic opportunity, education, work, and employment, and so much more. While the nursing profession is not able to provide solutions to all of these factors that contribute to this disparity, we provide a holistic approach to care for our patients. Looking forward, nursing can make an impact by providing patients with resources that address the emotional, financial, and lifestyle stressors. At the system and policy level, it's important to address the social determinants of health and aid in facilitating nurses and other healthcare professionals in meeting the community needs, free of bias on their social economic status, which correlates to their zip codes. Apart from the U.S. increasing the spending of healthcare, they rank in the bottom percentage of health disparities continuing to exist based on socioeconomic characteristics. The U.S. has a national average life expectancy of 78.6 years. Where do we fall on the scale? Based on where we grew up, Layla has the highest life expectancy based on her zip code in California of 81.36, which is well above the national average. Patrick is slightly above the national average with an expectancy of 79.35 years coming from a small town in Alaska. Kristen, who is from the second largest city in Nevada, has the lowest life expectancy of 78.12, which is slightly below the national average. Ideally, we would all like to live well beyond the national average life expectancy if we're in good health, healthy living conditions, and everyone should have the same chance.